Hello, I'm Marilyn Hunter. Welcome to the Labor and Delivery Women's Center. This is one of our LDR rooms. LDR stands for Labor, Deliver, and Recover. This bed is typical in all of our rooms. You're able to labor and deliver here in this bed. The bottom of the bed will move away and it becomes a delivery table. Every patient that comes into labor and delivery has certain routine procedures that are performed. One of them is the actual monitoring of the baby. Each of our rooms is equipped with a fetal monitor that monitors the contractions and the fetal heart rate. You'll have two pieces of equipment similar to these that will be placed on the abdomen. One is placed on the upper part of the abdomen to monitor the contractions, and the other one is placed over the part of the abdomen where we can hear the baby's heartbeat. During your labor, the monitor will be turned on, and you will be getting your baby's heartbeat, your contractions, the blood pressure, and in every room as well as at the nurse's station, there is a display monitor in which the nurses can watch all of the patients at one time. So whether your nurse is in the room with you or whether she is at the nurse's station, she can observe your monitor strip at all times and know what is going on with you and your baby. We also do the routine vital signs monitoring, blood pressure, and we can also do the pulse oximetry where we're measuring the amount of oxygen that's in your blood. But we have all this state-of-the-art equipment. We also have the PCA pumps. If you choose to have an epidural for your labor, you're able to control the amount of medication that you're receiving through the PCA pump. And anesthesia will interview you and discuss your options for pain management, and we'll go over all the risks and benefits involved in that. And if you choose an epidural, then you have that available to you. Once you're in labor and progressing through labor, your nurse will be at the bedside frequently, and she will be helping coach you through your labor. Will also be helping to answer any questions that you have and explain all the procedures that we're doing. You will have your visitors at the bedside. Once your doctor will be in and out periodically to examine you and to determine whether or not how your labor is progressing, and to discuss any questions and talk with you about your progress. Once you are at the point of needing to push, then the bottom of the bed may be taken away at that time and your legs put up in stirrups. Once the baby is delivered, the nurse will place the baby under the radiant warmer where we dry the baby, we assess it, and we keep it warm under the warmer until its temperature is stabilized. If for any reason we have any unexpected emergencies, we have our NICU staff that's on standby constantly. We have an alert button in the room that we can press, and it will alarm in the NICU area. The team responds immediately. They're here within less than a minute. And they have all the emergency equipment available and ready to take care of any needs of your baby. If the baby everything is going well, baby's temperature is between 98 and 99, then the baby may stay with you during the hour's recovery after your delivery. You're able to bond with the baby at that time. If you plan to breastfeed, this is an excellent time to try to breastfeed. And you also can have family in to visit, and they can come and see the baby for the first time and get introduced to you and your new addition to your family. Now we will go to a room where the bed has already been prepared for delivery. This is our delivery bed, our LDR bed, once it has been set up for delivery. The bottom of the bed has been taken away, and the leg stirrups have been pulled up for the mother to place her legs in to be prepared for delivery. The physician will be sitting on a stool. He'll have a delivery table that has all of his supplies that he needs for delivery. You can have your family at the bedside that can be here for your support and coaching you through your labor. The nurse will also be at your bedside to assist you in whatever needs that you have. Once the baby is delivered, the physician hands the baby to the nurse, and she'll bring it over to the warmer. And as I said earlier, this warmer is a radiant warmer. It heats and supplies a heat source to the baby because the babies initially, they're wet and their temperature is very unstable. So we like to keep them in a controlled environment and keep them very warm. And the nurse will do all the initial assessments. She'll dry the baby, check the baby and make sure everything is well, check his heartbeat, his breathing, its reflexes, and do what we call our APGAR scores. And the warmer has a on and off button. It has the light, exam light, and your family will be able to come at that time and video the baby and watch all the initial assessments and get to have their first meeting with the baby. And as I said earlier in the other, that we do have an emergency capabilities for getting the neonatal intensive care here immediately if needed. Once the baby has been assessed and everything is okay, then you can proceed with your bonding time. Once the delivery has been completed and the physician is completed, then we will put the bottom of the bed back on, clean linens, and have you ready to greet your family and your visitors. You'll stay in this room for 1 hour after your recovery time. During that time, you'll be assessed for any excessive bleeding, to make sure that everything is going normal with you, that your vital signs are okay, and allow you to breastfeed and bond with the baby during that time. After the hour's recovery is complete, then you'll be transferred to the obstetrical unit, to your postpartum bed, where you will have a room that is your family can come and visit you there in also. All of our rooms on the obstetrical unit are private rooms, and we do have suites that are available. And thank you so much for coming on your tour today, and we're very proud to have you choosing DCH as your hospital.